While always people are treating malaria and typhoid together, I don't know where people got this literature from that whenever you get malaria, you will get a typhoid. I don't know, I don't get it. Because I have not seen any literature in medicine that says that once this person get malaria, that means they have a typhoid. So where this information is coming from? You see, this thing has become so much rampant around the continent of Africa. They have taken malaria and typhoid to be now like I should say a family sickness. Once someone has a malaria, they presume they have a typhoid. And without doing any medical investigation, what are they going to do? They are definitely going to enter into the treatment of typhoid. Well, come to this platform. Let me try to explain some of these issues to you. What is relating to this malaria and typhoid? First, before we go further, I want you to check my platform. I make a video concerning the same issue on malaria and typhoid. Malaria and typhoid, I say in that video, they are not brother and sister. Just go check that video. When you check that video, you are going to understand what I'm saying. And then I also went further to explain in that same video why always African are having this issue of rampant malaria always. When I say rampant malaria, why people are always coming down with this malaria issue, why it is too much in Africa. Now, I discussed basically it is a factor of immunity. Now, if you also check that video, I also make video on immunity. All you need to do, follow the platform and you are going to learn more about it. But as today, let's go to the point. Why always people are treating malaria and typhoid? Before we go further, I want to say thanks to everyone who have taken their time to always support me on this platform, who are always sharing this video to make sure it go viral for other people to get education, who are always liking, commenting. I mean, in whatever way, I'm really grateful for you guys. I just want to say thanks to everyone for your kind support. My special message to everyone, please, just like, share, and comment on this video. Now, let's go further. Why always people are treating malaria and typhoid together? Well, let me say something. It is totally wrong. And there is no literature in medicine that says that when you get malaria, that means you will get a typhoid or you have a typhoid. There's no literature. So why always people are doing that? Why they have? I don't get it. Where they get this concept? Now let me say one thing. If you encounter malaria, what happens is that there will be so many signs and symptoms, fever and other things. Now this is the error portion of this malaria and typhoid. When people encounter this malaria, they go and do a typhoid test. To be very specific, water test. Now, everybody come closer, both health worker and non-health worker, and especially you, the patient that is always doing this thing. When you have a malaria, you go, you run a water test. The water test is simply the typhoid test. Then they used to use. It will actually shows that there is a typhoid because of the fever you are experiencing in that malaria. It's actually going to show there is a typhoid, but it is not true. So why are you always doing this? In fact, for the new update, this water test is now updated. If you actually show of your typhoid, like you want to take typhoid to be your classmate, if you show you have this typhoid, let me recommend something to you. You can do a culture test. It is the most standard test you do. When a culture test tell you you have a typhoid, then you have a typhoid. When they tell you you don't have a typhoid, you don't have a typhoid. But this issue of this water, in as much as you have malaria, 98% of the chances this water test will show positive. And I think this is one of the basic that other people have taken this malaria and typhoid thing to be like a family issue. So please, if you go to the hospital, if you have a malaria, do a malaria test. If you are sure of the typhoid, you can easily do your culture test. If the culture test says you are positive, then fine. If you are negative, fine. Now let's go to the disadvantage of treating this malaria and typhoid where there is no typhoid by presumption. There is something in medicine we call drugs tolerance. What is drugs tolerance? It is a system where it is a process where the body have getting adjusted to a particular drugs by constantly repeating the drugs over and over again. What will happen to drugs tolerance? This medication, they are not going to work. That is one of the things. So have you asked yourself why you're always treating your malaria and typhoid and you keep having the same malaria and typhoid? Probably you have introduced one medication in your body more than as expected by the body. At the end of the day, you become drugs tolerant. Not only drugs tolerant, toxicity effect is also there. Because these things you are taking in your body, they are all chemicals. So whether you have a typhoid or you don't have a typhoid, the body does not care. These medications, they don't care. They are chemicals, they go in your body, they are going to cause harm for you. So this issue of malaria and typhoid, if you are not careful, You're actually going to use your own money to buy your own problem. So that I advise everyone on this platform, if you have a malaria, treat your malaria. You don't have to say because you have malaria, that means you have a typhoid. You can treat your malaria. It's so simple and easy. If there's other factor that is in your body, you check for it. But it should not be you have a malaria and you have a typhoid. Thanks everyone for watching this video. Thanks everyone. Please, we'll see you next week, Saturday. If this is the first time coming across, my name is Fori Kamara from Punjab University, Patela, from the Department of Pharmacy. See you next week. Bye-bye.